It's wonderful to be here. I was here this past spring, so some of you may have been introduced to a little bit of what I'm doing, but I think I've got a little bit of a different bit of a focus, or at least I'm able to share some more of the work that we've done more recently. But it's great to be here. Thank you to Rob Tarswell for his introduction, and also thank you to the Between Worlds Beyond Disciplines Planning Committee for inviting me to be part of the anniversary celebrations for Green College's 20th birthday. The time I spent here as a resident was tremendously formative for me, and I've symbolized that here on the first slide that I'm presenting. It significantly influenced how I have approached developing an interdisciplinary health humanities presence at the University of Alberta, which is the focus of my talk today. It was at UBC that I first experienced the possibilities of interdisciplinary scholarship. I was introduced to a fully integrated interdisciplinary life as a doctoral student with the Interdisciplinary Studies graduate program and as a resident of Green College. I was also a member of many interdisciplinary research centers in the health sciences and in education as well during that time that I was here. I loved it. I loved every moment of it. There was a wonderful feeling of rightness, of being in the right place at the right time. And then there was a sort of a juncture where it was the next step in the journey. I married my husband before finishing my PhD, and we needed to consider where we might live. His job could have him situated in Edmonton or in Calgary. And after carefully considering the two options, I suggested that we move to Edmonton, as I felt there might be more job opportunities related to the field of arts and health there that I might potentially apply for following completing my degree. And in fact, such positions tend to be as rare as hen's teeth, so I don't know really how I was thinking that was going to be possible, but I had to believe it. I had to, as I was finishing. And in fact, an opportunity to develop an interdisciplinary focused medical humanities program did open up in the Faculty of Medicine and Dentistry at the University of Alberta, just as I was finishing my doctoral dissertation. Success occurs when preparation meets opportunity, but how do opportunities arise? In my case, there were others with common interests in the faculty, and a dean at the time, Dean Tom Mary, who, inspired by the dean he had served under at Dalhousie, Dr. Jock Murray, some of you may be familiar with Jock Murray's contributions, decided to create a medical humanities program while he was Dean of Medicine at U of A as a legacy project. Jock Murray had created the first medical humanities program in Canada at Dalhousie in the mid-90s. So we're talking about 2006 at this point, and this is the second medical humanities program with a programmatic sort of structure that was being introduced. Although primarily a clinical researcher and practitioner, bedside teacher, and administrator, Dean Tom Mary recognized that there was something important about having such a program in the faculty. He couldn't quite name what that was going to be fully, and I don't think any of us did know fully, and we still don't, because it's still becoming what it is as the program responds to the people who are involved and the interests of students. The AHHM program, as I mentioned, is one of 3 dedicated medical humanities programs in Canada, although there is growing activity in this area, both in Canada and around the world. So, in my role as founding co-director of the AHHM program with Dr. Verna Yu, and now director of the AHHM program, I've attempted to emulate what I experienced at UBC as a graduate student. I have been attempting to do so by recognizing and supporting the passionate interests of learners and the creative process often involved in opening to new questions that may be identified at the intersection of disciplinary fields. Also, by recognizing that such inquiry is inherently relational, recognizing that interdisciplinary inquiry and working together collaboratively across disciplines can be helpful in illuminating issues that cannot be explored from a single disciplinary perspective. And finally, I've been committed to working to create spaces for dialogue and inquiry into these various interconnections between medicine, health sciences, arts and humanities, social sciences, et cetera, et cetera. In supporting students in realizing their aspirations for their individual learning journeys, I've developed a broad array of electives which have effectively extended options available to students who are interested in exploring the human side of medicine. students have appreciated the opportunity to relate their medical studies to either an emerging, for those who emerging interests in these areas, or for those who have studied literature, drama, art, and design, etc., prior to entering medical school, long-standing interests in these areas. As I'll provide a few examples in the next set of slides, our now named Performative Reflection Theatre elective, Artists on the Wards and Spiritual Care shadowing electives are all popular. In mentioning this, it's either the students' interests that are driving it, and sometimes it gets institutionalized as well. So, for example, the theatre approach to enhancing medical student empathy arose from a medical student's interest, who had a background in theatre, interest in aligning theatre with medical education to better understand communication and what is known in the body. Sometimes there's more than we know. We know more than we think, in a way. There is knowledge, there's intelligence in the body, in our interactions one with the other. And there's and the contributions of theatre instructors from the Department of Drama working with students over time has helped to make this one of our most successful and popular electives. So Aleem Nagji, it was his idea. He brought that forward. We piloted it. We've now had numerous years of offerings that have been in place. Students' own interests have driven their projects that they've looked at in terms of following arts-based approaches to research. Rane Tao looked at the art of medicine. She was wondering, what do people really mean, or what do they think they mean when they're making mention of the art of medicine? And so following a methodology that has sort of a popularized, I'm not sure how many people have heard of it, 50 people, one question. Has anybody heard of that? It's a very interesting sort of piece where people have videotaped and really short video segments of people who answer a question, but 50 people do it one after the other, and then the segments are compiled, and it's a really lovely sort of approach. So she invited faculty, staff, residents, students, others who were interested in sharing their perspectives on this and brought it together with a background in music. And so it's one of our now short videos that we have available, and you can see a number of the students who were participating in that. Jessie Breton likewise followed an interest before she, at the end of her fourth year, before going into her psychiatry residency, wanted to look at issues related to depression after giving birth. And so she did this piece called Birthmarks, which looked at all sorts of different dimensions of that and expectations or ideas about women and birthing, etc. And so this has gone on. She did an artistic exploration to the medical, personal, societal, and historical dimensions of postpartum depression through a collection of sketches, collages, and journaling. We not only provide opportunities for students to do this work, but to present on their work in speaker series, fora, publishing in various student-run journals that include humanities columns, and in other places, exhibits, etc. I'll talk about that shortly. When she presented, she was presenting to members of the community. We have 1,000 people in our listserv who are interested in knowing about the events that we organize. And a number of the people that were there had experienced postpartum depression, along with practitioners, physicians, along with students and residents. So it generated a wonderful dialogue and conversation. People were very interested in her insights following from her artistic explorations. More recently, Danielle Lewis, Katie Stringer, Bailey Adams are three students who completed a film on birthing options that promoted the idea of interprofessional collaboration between midwives, doulas, family physicians, and obstetricians. They were concerned that they were only hearing about difficult deliveries and the required interventions required to assist women with birthing, and they thought that medical students need to know about the whole spectrum. So what they decided to do is to create this film. They interviewed health professionals involved in this area across BC and Alberta, and have now, their film which is about an hour long, has now gone forward to all sorts of different meetings, conferences, other settings, and has won awards. They have, as I mentioned, won awards, but that has generated additional work that they're involved in. Danielle and myself, along with other faculty and media artists, have, for example, submitted a proposal for firsts experienced in medicine, first baby delivered, first experience of a patient's death, etc. And we're looking at this being an educational resource in medical school. We've had students that have come from other medical schools to take some of our directed studies electives. So the students who just wanted an opportunity to spend 2 weeks exploring a question. Deirdre Noonan came to us from UBC. She was going into an obstetrics residency at the University of Saskatchewan and wanted to spend that last 2 weeks of her 4 years exploring the meaning of scars. So she's going to surgery. Her background was in English literature. She wanted to study, again, Michael Ondaatje's novels on this topic and consider that in terms of what she was going to over time. More recently, and I'm making connections back and forth with BC because I'm here, and there are lots of interconnections. Megan Doherty is now at the University of Calgary, and she came and spent 2 weeks with us again. She completed her Master's of Fine Arts in Creative Writing here at UBC, and again is developing a pathway of becoming a physician writer, of which there's a strong many before her who have done that. So we benefit from their inquiries, and we believe that it's important to support their own interests in terms of the kinds of physicians who they want to become in the field of medicine. I'll talk very briefly about this. So we've had these electives and opportunities, but we've also started to create a studentship in the summer for even more a more in-depth project experience that students can complete. So this is an example. Gregory Sawatsky looking at patient voices through photo voice. We have, as well, wanted to look at developing opportunities for advanced studies in this area, whether doctoral program, master's program, certificate program. Perhaps we should start there. We're really not sure. We've been a little bit stalled on this, in part because of budget cuts that we've been experiencing. But we still wanted to do a bit of an environmental scan in a novel way to even identify all that was going on at the University of Alberta in relation to this and who we might involve in imagining what such a program might look like and who might take up different roles in relation to that. So in 2012, my colleagues, my amazing colleagues from Art and Design, Bonnie Sadler-Takich and Aidan Rowe, Bonnie being sort of the one with these fantastic ideas that leads us forward when we think, really, is that really possible? But she imagines these things, brings us forward. We also get involved in imagining it, and it happens. So we invited people within the University of Alberta to bring forward their visualizations of what the health humanities means to them, how they're involved in it. And we didn't know what was going to happen, whether anybody would respond. In fact, we had quite a few responses. I think we had over 30 submissions that were exhibited. Over the 4 weeks that we had the exhibit at the Fine Arts Building Gallery, 840 people viewed the exhibition. There was a dedicated website, a book publication that came out that I shared the last time I was here, and media coverage that promoted awareness and active discussion about the topic. So some images from the exhibit appear here. We felt that this exhibit made visible and made us feel more confident about the vibrant community of individuals, artists, practitioners, etc., who are currently engaged in work that could be considered within the realm of health humanities at the U of A. And we also learned that there was a desire for dialogue regarding the potential of the health humanities over time. We asked one of the leading people in this area from Peninsula University in the UK to write a foreword for our book that documented the exhibit. And he was wonderful. He offered to do it. He did it very quickly. But he gave us a challenge. He wrote in that that it was, that he recognized the value of first exposing local contributions to an emerging dialogue, but encouraged us to expand our efforts to include international input and output of the highest quality, showcasing a vital cultural force, a subtle and unstoppable impulse to democratize medicine for the public good, which is what he views as the aim of the health humanities. Given this response, the response that we had from the public, from our own community, and Alan's encouragement, we extended our inquiry this past year to include a broader range of perspectives on the health humanities. There are two books that have been going around that some of you may have gone through, and that's the book that documents this last exhibit that we did. So I'll talk about that a little bit. Here we're looking at further community engagement. We want to look at not just visualizing the health humanities, but how the health humanities can be engaged for creating a better sort of world, a healthier community, a healthier world for all of us. And we also wanted to engage national and international contributors to this broader conversation. There are many more components to our exhibit activity. I'll go over a few of them. They're listed here. We began with an evening workshop in which we brought medical students and residents and design students together to develop ideas relevant to working with communities in relation to health humanities. And we had a fantastic response to this, and they were coming up with the different design ideas that we would actually use in the end for the exhibit. What that inspired us to do is to go forward with thinking about actually creating a course where medical students and design students could work together over time, over a longer sustained period of time, not just the one evening. We ended up getting this sort of design piece together. We held a fantastic, again, exhibit. There was a symposium, the book publication. I'll just go over this. You'll know about that, so I won't go into that at all. We also decided to hold a symposium to help to provide a framework for these extended conversations, which has led to a number of collaborations and other initiatives that are taking place right now at the University of Alberta. This is the collaborative course project. So for design students, it's called Radical Imagings and Imagining Social Design in the Health Humanities. For our students, we named it a little bit differently because it was just a one-week full-on elective. But they came up with some fantastic ideas, and I thought that was so, so valuable. So we will do that again. It's not offered this coming year, but it will be offered again. These are some images from the work that they were doing and the places that they were working. I am near the end of my talk. And so I will end by saying there's much that we have done. The exhibits have been also a really wonderful way of developing relationships and inquiring, not knowing what the outcome is going to be or what the answers are, into these new areas that we might bring health humanities forward into somewhat more. There's much going on, so I've sort of listed here a few things that we're doing. Some of these have been have resulted from the Insight exhibit. There's much going on at the national level as well, and I'm sort of noting a few here just to give a sense that it's, this is happening within a larger field. And internationally, we're also developing collaborations across medical schools. In closing, I want to recognize all of the students, residents, and faculty members, interested community members, and others who have contributed to or attended program-related events and offerings. And I also want to, returning to where I started out with, recognize all of the deans who have supported this work. Jeff Nisker, a colleague of mine at Western University, wrote a beautiful essay as a testament to Dr. Carol Herbert, who many of you will know. She was chair of family medicine, family practice here before she became dean at Western. And as she was leaving, he wrote this wonderful essay that was entitled, "There But for the Grace of Our Deans Go We." And certainly, you may feel that in all sorts of different corners of the university, but in health humanities and medical humanities, in faculties of medicine, that really applies. So it's been wonderful to have our deans support, all of our deans. I think that curiosity, passionate interest, and the ability to imagine beyond disciplinary beyond disciplines leads to ever-expanding horizons of possibility. And to coin a phrase, you never know where a question will lead you. As I imagine all of those who support the work of Green College know, I have found it a joy and privilege to support students and faculty in following their most passionate questions. Following an inquiry path that is unique to their own highly generative questions, they have become involved in productive and rewarding collaborations with others. And they have also, I believe, really found a way to commit to a path of the kind of physician that they want to become because of the freedom that they've had to follow those questions. Today, I've shared some of my story post-Green College, but I recognize that all of you, all of us, are living stories of our various interdisciplinary interests and passions. We are all in the midst of such stories, which is what is being highlighted in a wonderful way at this celebratory workshop. I look forward to hearing more about all of your involvements and projects. And I just want to end by saying I wish Green College a wonderful birthday. May it have many, many more.
I saw a hand over there.
Thank you very much. Wonderful talk. I'm very, very interested in the work. My father passed away this past summer. He was in the oncology ward at the Tom Baker Cancer Center in Calgary. And it was interesting to see the quality of care that he did get, generally excellent, but seeing almost a bit of a generational change between the various doctors that would visit him. And please, I'd like to hear your thoughts on this. Is it a case that the school of thought in medicine in the past was to dissociate yourself completely from the patient? This is the patient's problem, don't make it your emotional problem, don't become emotionally involved. And what I observe here, is it a case where there's a change in that mindset to become somehow re-involved and empathize with the patient more and deliver healthcare in that respect?
I believe there is. I think that is definitely happening, and there may be others in the audience who could speak even more directly to this, but I can share what I know is happening at the University of Alberta, and I know is happening at other medical schools, is that clinical experiences, being with patients at a much earlier point in training is occurring. We just recently had a session on spirituality and health, and one of the fellows in our psychiatry department, his name is escaping me right now, shared that he did a chaplaincy, a Canadian pastoral education unit, because he felt he wasn't well prepared to be with patients in their suffering, in their moments of hearing bad news, and all of those ways that patients may be having a really difficult time. And if you don't feel prepared for that, then often you'll just shut yourself down and let that be, perhaps given over to the social worker or the nurse, or just assume it's going to be taken care of elsewise. But what's happening right now, for example, this is a fantastic piece for us, is that we've got students who are meeting with patients from the earliest months and just being with them and being witness with them, going to their doctor appointments, not to see what the doctor is doing and disregard the patient, but to actually see how the patient experienced the healthcare system, to hear their stories of what that meant to hear that diagnosis, et cetera, et cetera, et cetera. So there is a shift, and it's happening through our educational processes as well. Thank you. Sorry to hear about your talk. Yeah.
Well, I have to congratulate you on the brilliant design that one sees throughout all this presentation. Amazing, amazing work by whoever you're having as your designer. But I wondered, it seems a very fine arts focus here, although you did mention Michael Ondaatje. I wondered how far you take that humanities concern. I mean, where does the line between humanities and non-humanities lie for you?
So we try to be as broadly open as possible. We also have at our medical school John Dosseter Health Ethics Center. We've got a history of medicine program. We have health law. And so while I promote all of those as sort of just letting people know about them. I haven't taken those over, and our medical school, for whatever reason, hasn't sort of put us all together to figure out how to be all of this. Certainly, we have a national educational interest group that's called AHHM, Arts and Humanities, Social Sciences and Medicine. That is, again, trying to be that wide open, but we often think that we're not doing all we could to bring in the social sciences perspectives as well as we could as well. So there's more we can do, certainly. Yeah. Yeah.
I think we begin to tell you how inspiring this is. I think what you guys are doing is just absolutely amazing. And to me, this is a lived example of what I would call creativity in action, so that the interdisciplinarity that happens in this context and the practice of interprofessional collaboration too, that we see between students in the arts and in medicine, is really a lived example of creative thinking. So I'd love to talk to you more. But my quick question for now has to do with the availability and the accessibility of this kind of curriculum courses and sensibility to the students. This is offered as electives to students right now across the institution, which tends to be a trend. If you look at institutions that do medical humanities or these unconventional interdisciplinary initiatives within a very traditional disciplinary setting, such as medicine, it tends to be offered or relegated to the electives. And I'm wondering if there's been any discussion in your institution about creating a program or a minors or a stream. How are students finding that in terms of their accessibility in relationship to their core program?
We were talking about that, Keith Benson and myself, just a bit earlier, and part of it comes from the way that medical schools are accredited. If medical schools are very responsive to what needs to be checked off in terms of accreditation standards, there is not a lot of arts and humanities in there. Therefore, we're more elective. However, we're finding creative ways of doing just as what you're suggesting, the pathways, or colleges within medical school. There's different names for it, so students can sign up. So, for example, at Stanford, there's one on medical humanities. It's one of the smallest of the pathways in terms of numbers of students that sign on, but they are wildly dedicated to it. It's a minors program, yeah. And with our patient volunteers piece, our patient immersion program, we will be having students, as a requirement, create interpretive projects related to what they learned from their patient volunteers. And we will have an exhibit where we bring the patients and their families and the students and their families together to witness all of the stories that are conveyed in these interpretive projects, and that's going to be a requirement. So slowly we just try to find creatively ways to make it part of what's going on. Thank you.
Time for one more.
I guess my question is, do you collaborate with fundraisers or donors at all? And the reason I ask is because I work with a hospital in the Toronto area, and a lot of my work with philanthropy and fundraising is briefing physicians on how to do 5 and 10-minute stories. They're very inspiring for leadership donors especially. So for board members, for cabinet meetings, for one-on-one meetings. So I'd be curious if there's a connection to that fundraising philanthropy and storytelling.
Right. We could just personally talk later, and you could give me tips, because we don't have a lot of donors for this activity, and that's been interesting to us, because I thought it was going to be something I would just go and ask the development office to help me with, and it would happen. Okay, others have experienced that. And then I had a new development person who came on, and she said, I'm going to take on geriatrics and arts and humanities. This is going to be easy. I'll make my name. And where I work, in the community I live in, people want to put their donation dollars onto finding the cure for diseases and different conditions. So it has not been easy to do, but no, I haven't. I've been to a workshop recently about the sort of 5-minute story and talked to donors, but I have not talked to physicians about how to convey those stories in that way. But thank you. Thank you.
So let's thank our...
Thank you.